I do after BDS? Very frequently asked questions. The moment I finished my internship, I went to Mumbai to work in Dr. Sandesh Maikar, one of the leading dentists in India. I'm really confused what to do from tomorrow onwards. That will be there for many people. In those days, my registration number is 2428. Okay, only 2400 dentists have registered before me. Now the registration number is almost, it has touched 40,000 in Tamil Nadu Dental Council registration. So there are so many colleges. Now this data was taken in 2018. That time 29 colleges, now 34 colleges. Comparatively more colleges have come. How you are going to be survive in this? This is what I am going to talk next time. So what is the scope of dentistry? இந்த முடிச்சோம்னா நமக்கு என்ன இப்போ நிறைய பேருக்கு இந்த doubts இருக்கு. What we are going to do after my BDS. So what are the options? I used to give a lot of career counseling programs. I gave it in GDC also about a year back. Almost 400-500 students assembled there. These are the traditional ones which we do. Clinically, either go to the government job, or work as a staff in a college, or do MDS, or do clinical practice. This is what we normally, or in Army College Trust, corporate, dental assistant, clinical dentistry abroad. So you choose what is best for you. Sit with your parents and decide what is going to be. So if you have contacts in abroad, your relatives are there, they can sponsor you can go to abroad. Other things, if you are interested in army, definitely you can get into army. There are various avenues of that. These are the opportunities available. Government jobs are less, but MDS is not the only solution. There are other opportunities out there. Yes, sir. So other non-clinical senses. I'm telling you, if you are a breadwinner of the family, this medical transcription or virtual scribing is the one which you can do it part-time and earn money. 50,000-60,000 rupees initial payment you will get. Along with it, if you work in a clinic and here you can solidly make around 80,000 rupees per month. So these are the things which you will be given training or short-term training. You can take it in various institutes. I can give it further. I can talk in length about it, but that is not my topic today. So these are the opportunities available. You can do MPH, work in some public health department in government sectors, or MBA, MHA. What choice you are choosing is very important. If it is MBA or MHA, if you are doing it, it should be clinically oriented if you take it. That too, offline classes are better, don't do online classes. And for forensic dentistry, pharmacovigilance. When I completed my BDS, I did my clinical research, postgraduate diploma in clinical research in 2003. The immediate payment for me salary is 1 lakh. But the thing is, you can't have it. You have to go and work in the pharma companies. For me, they were giving job in Hyderabad and Trivandrum. But I have a passion towards teaching, so I didn't go for that. So if you have something like that, definitely you can do it. These are the other non-clinical options are available. So not only clinic or MDS is the world. It is not only that. You have opportunities like this. So what's more important? When I ask most of the time, either the money, fame, patient comfort, what you are doing it for the patient, uniqueness, that is very important. In what way you are going to be different from the others, and workman's skill, or being a leader or to be led by others, that you have to keep in mind. So as Mahatma said, you must be the wish to see in the world. So first of all, you change your mindset. We'll see, go through that now. So as I told you, you should be unique and different from the others. When I used to come here in 2007 or 8 when the college was started, hardly the dental clinics, right from Perungudi till Kelambakam, Chettinad Dental College. Now see the amount of dental clinics now. How you are going to be different and unique from the others? You have to keep updating yourself then and there. You incorporate latest equipments in your clinic. No more you can take in alginate impression. You need the scanner. You have to know about aligners. You have to know about implants. All this latest sophisticated you have to incorporate in your practice. Then only you can come up in life. So you have to keep updating yourself. Yes. So winners don't do different things. They do things differently. This is Shukara quote. Like that, if you want to be successful, you have to do things differently. Keep that in mind. Yes. So we have a lot of sophisticated equipment, Florida probe, lasers, perio scans, or intraoral scanners, or you want this thing, lasers, low-level lasers. All those things are there in your day-to-day practice. You can use it. So as I told you, why it is important? Should I have to buy all this? Yes. If you want to give the patient, ultimately they pays for you. In my 30 years of clinical practice, I will tell you one thing. The patient pays you for your service, the value you give to your service. Keep that in mind. They are not paying for your crowns or how well you treat them and how you provide that service, how comfortable they are, for that only they for it. So for them to be comfortable, you incorporate latest equipment. Instead of keeping the tray and use the scanners and scan it and do it, or laser instead of bleeding pain. That is the reason why they are scared of dentistry. If you can do that with the laser without injection, without bleeding, without tablets, then incorporate that in your practice. So definitely it is not the same. If I do with the blade, what the hell I want to go for the lasers, if you ask me, definitely the treatments is going to be, whether it's an electrocautery or if it is going to be a laser, it should be patient comfort. That is what you have to use it in your practice. Yes. So this is how the different perceptions of dentistry, how your friends think, how your mom thinks, how your society thinks, what patients think that you are a pickpocketer. But what I really do is this. This is what normally the perceptions of dentistry. So here always I put this slide. A pessimist sees the opportunity, difficulty in every opportunity. An optimist sees the opportunity in every difficulty. Whether you want to be a pessimist or optimist, it's up to you. I want you to be optimist. That's why I asked you the first question. Are you want to learn something today, something new today? This is what I'm going to tell you. Be optimist. See what are the opportunities you are going to get, which is going to come on your way. Next. So this is an innovation council. I thought first few slides I want to give it on innovation. Lot of government, state government, central government are providing lot of fundings nowadays for innovations and for your startups, etc. Lot of fundings have been done. If you have an excellent idea, making some video reels or making something innovative idea, I don't know how many of you, I think there was no anybody presented in Midas that scientific innovation from this batch? Okay. So there are a lot of presentations came up for entrepreneurship. So something unique you can plan. Somebody came with the brush which calculates how much time you brush, what way of brushing. It is connected to the app and mouthwash. So many things they were doing it. Same way you have lot of things in our innovation funding. Central government, nowadays you don't even have to go and knock the doors of state innovation council. You can apply directly to the central innovation council and take the help, get the funding. If you have a good funding, then it will be useful. I joined recently, 2 years back, I joined one young entrepreneur school where they teach us about what business is all about, which I didn't learn in all these 30 years. In my dental college also it was not taught. But they taught me how you can get the innovation, how you can use the cube labs to have an idea. If you have an idea, it will be expanded and you can develop into a concept or an innovation, and based on that you can do it. So these fundings are there. If you want, you can take the photo of it. So these things will be useful for you if you have some innovation. Not necessarily you should have only your dental clinic or MDS. These are the opportunities there are Plenty are there. Just keep in mind. Next one.